You are now listening to Extracting Wisdom. Here to help you prevent the decay of your future is your host, Brandon Evert.
Thank you so much for tuning in to another episode of Extracting Wisdom, where we are all about preventing the decay of your future by bringing future dentists together to learn from each other and to make the future of dentistry that much brighter. My name is Brandon Evert, and I am your host, and today I am so happy to introduce my friend and fellow D1, Mr. Seth Breaker. Seth, welcome to the show, man.
Hi, thank you for having me.
Absolutely. I've been wanting to have you on for quite a while now, ever since we started dental school, but I'm glad we finally got around to it and found the time to do this. So the topic of conversation today, we're just going to keep it super light and easy. I just kind of want to bounce some ideas off of you and hear about your experience with dental school so far. But before we get into that, why don't you tell us what made you want to go into dentistry?
All right. So what got me into dentistry is just as a young kid, I just loved going to the dentist. So it was kind of strange about me. And then also just a job show I went to in high school. It was a job show as a sophomore, and it really was just eye-opening. I really loved the fact that I could work with my hands and just help others. So that's when I kind of made the commitment to get into dentistry. Okay. And then from there, it progressed into college. I went into the mindset, I want to be a dentist. And then in college, I actually really fell in love with dentistry. That's where I went on more job shadows. I met more people, listened to podcasts. Podcasts are a great way just to immerse yourself with other people that are really motivated about dentistry and really excited about it. It just gets you really excited. So I just really fell in love through podcasts. And I would say last, I guess, would be just a few missionary trips I went on. It was just an eye-opening experience, knowing that seeing people out there that need help, especially even through oral care. So that was one thing, and it kind of made that desire for me someday to do missionary work with dentistry. So it's just, very cool. And on top of all of that, I would also say even owning my own practice someday. I'm a huge, entrepreneur in that way. I just can't wait to get out there. Yeah. I know you're the same way. So
yeah, of course. So did you, that's very unique that you discovered dentistry so early, which is awesome because you were able to kind of especially go into undergrad with that mindset that, good grades, I got to get through because I want to be a dentist. Right. Did you ever think about like being a doctor or anything, going into medicine?
No, weirdly, no. Really? I've always it's always been dentistry. I mean, knowing that I can own a practice someday, that's kind of been, the driving force too. I mean, you don't get that chance if you're going to be a, practitioner, like a physician or something, you don't get that, but having that balance of work and life and dentistry is just something you can't beat.
Absolutely. Yeah. And we hear that time and time again from other podcasters and other dental students and dentists now that it really is such a flexible career. You can really make dentistry what you want it to be. Do you want to do just the bread and butter dentistry, or do you want to learn extra procedures like implants or Invisalign, or, do all your own endo, those kinds of things? Do you want to own your own practice? Do you want to, go into an associateship? You have so many options in dentistry that you don't necessarily have as like a doctor per se. That was one thing. I wanted to be a pediatrician really all the way up until college. My dad is a high school science teacher. So growing up, I would always go in for dissections and stuff like that. And I loved the sciences. And I thought that I wanted to be a doctor at first. And I don't know if you've heard, have I ever told you this story? I don't know if I have.
No, I never knew that. No, that's interesting.
So then high school came, and I took an anatomy course. So we actually did donors and everything in high school, which is pretty neat.
Yeah, that's really surprising.
I know. And that's when I'm like, wow, I really like seeing the inside of the human body. And I'm like, orthopedic surgeon is something that I really want to be. And so I had this conversation with my doctor senior year of high school. I was getting a physical for baseball or something like that. And he's like, well, Brandon, it's about that time. Like, what are you going to do? And what are you going to school for? I'm like, well, I really, he knew I wanted to be a pediatrician, but then I told him, I really want to be an orthopedic surgeon, I think. And he walked over to the wall and started banging his head against the wall. He's like, okay. He's like, before you jump into any decisions, he's like, go shadow dentistry. And the rest is history. But that's what I saw the same exact thing you saw, is just the flexibility, the total transformation of, your patient walking through the door, to treating them and diagnosing them, to watching them walk out of the door. As a doctor, you don't necessarily always do that because you're handing them off to different physicians who are specialized in different areas. So yeah, absolutely. I totally agree with you on that.
Mm-hmm. Yeah. Even the job shadowing the dentist, you just get to see that relationship between a patient and a doctor. It's just something you don't get to see as a physician.
Right.
It's a completely different dynamic. I like that. I mean, that's just a great thing.
Definitely. Absolutely. Okay. So now that we know, why you wanted to be a dentist, which is awesome that you discovered that so early on. What was your application cycle like? Did it go smoothly? Any hiccups? What was the whole process and interview process like? Like, how many schools did you apply to and that kind of thing?
Okay. Actually, I felt like the process went pretty smoothly. Happy to say. I mean,
good. Yeah, that's exactly what we want to hear.
Yeah, I mean, it was pretty smooth. I applied to 9 different schools.
Okay.
I got accepted into 4.
Good.
And I went to 3 of the interviews. So I went to Southern, Midwestern, and also UIC.
Okay.
And I think obviously I would say most pre-dental students or dental students now would say the DAT was the most difficult part of the the process.
Definitely.
And just, I guess for me, that was probably my biggest hiccup, was just trying to figure out how I was going to tackle it, how I was going to study for it. And I think I spent like 5 months, studying for it.
Yeah.
And that was, for me, it was too long, just because I wasn't studying, like, I didn't have a schedule. I wasn't like purposeful about it. I was more of just, saying I was studying for it and not really structuring myself. And then I think, for that, like the last month of that 5-month period, I really got myself into a schedule, hit it every single day, like a certain time amount, and had a certain way of doing it. And that's when I really learned a lot. And that's when I did well in the DAT. So I guess one of my biggest advice for any pre-dental students is don't like spend so much time studying for the DAT, in the sense of you need to have some sort of like schedule. You have to have some sort of
routine.
Yeah, just something made. Yeah. And I think a DAT boot camp has a great made schedule for you.
Yes.
And that's why I went through. And that's why I discovered, and I actually went through that, and it worked out great. And that's what I'd recommend to any pre-dental student, is just go on DAT Bootcamp's website, check out their calendar or their to-do list, and just tackle that every single day. And that's what I ended up doing. And it was great. So that was my biggest hiccup. And I think that's what helped me get out of it.
Yeah, definitely. And that's something on this podcast too. I preach the DAT bootcamp because I loved it. It's the schedule of it. And I mean, the price might seem a lot, but I mean,
in comparison though to other.
Definitely. Yeah. Because I know that Kaplan course, people spend $1,200 or something like that to go through it. And I would say that like the majority of people, it isn't 100% helpful. Like it's not super helpful to people that I've talked to, at least. And I haven't personally gone through it, so I can't talk about it, but I can say that the DAT bootcamp, number one, it's a great way just to hammer out practice questions. And I think that's a great way to practice. And it sounds like kind of like what you did your last month, is you really just hunkered down and just did practice question after practice question. Yeah. And again, one thing that I love about DAT bootcamp is I think it was harder than the actual DAT, those practice questions. I always found which is an awesome thing, because all of those PAT questions with all the crazy keyholes and pattern folding and all that kind of stuff, you get used to a certain level of difficulty. But when you go to the actual exam, you're like, wow, this is so much easier than the DAT bootcamp. So I highly recommend, DAT bootcamp. That's a great tip. And obviously you settled on UIC.
Yes. Yep.
We're classmates. So what about UIC? What made you choose UIC?
It was kind of a group decision between me and my wife. So I'm married, and we both decided that we wanted to. I'm from a small town, so just a little background there. From a small town, and we both just kind of wanted a new experience, move to the big city. So that was one of the big driving forces. But along with that, even obviously the clinical experience from UIC is something that is, from what I've been told, and I know from just even my little bit of experience actually being in the clinic, is that it's a great environment. You get a lot of patients that need help. The UIC clinics in an area that a lot of people that need access to care go to. And so you see a lot of interesting cases. And that's something that some other schools sometimes struggle with finding enough patients for dental students to practice on. So that was another huge deciding factor for me. And they have a really good community outreach program, which is really important. Just being able to get that experience of talking with people that don't know much about oral hygiene, and just immersing yourself in the community. That's a big key role as a dentist. We need to be able to do that.
And in fact, next week, next Tuesday, I think we're going to a local elementary school to teach about oral hygiene, and we're going to be in the same classroom, so that's going to be a good time.
Yeah, we got a lesson plan and everything.
Absolutely.
We'll see how that goes.
Which is something we still need to figure out. We haven't even talked about it. But that's okay. That's for
third graders and fourth graders. So we'll see how that works.
It's Friday. It's Friday night. That'll be a worry for Sunday or Monday.
Yeah, exactly.
Going back to UIC too. One thing that was unbelievable is we went to the midwinter meeting together, which is really cool. We got to see some live implant placement and some other live surgeries. But afterward, we ran into that older dentist in the bathroom, actually.
Oh, yeah. That was interesting.
And he was asking us a whole bunch of questions, but he could not believe, as D1s, we're already placing amalgam restorations. We're already on class 2 cavity preparations now and learning how to restore those. And I think that's just awesome. I don't know where other schools are at in their curriculum, but I think from what I get the feeling that I think UIC is a little bit ahead of the game on that. So they get their students in the clinic early. We're doing wax ups or doing wax ups into occlusion. We're in the sim clinic, once or twice a week. So I really think we get a great experience. And by the time we are ready to treat, or by the time D3 year comes around, we're going to be so ready to start treating patients. It's going to be a awesome experience.
Yeah. And that's something I didn't even expect or know what to expect when it came to that. But just hearing his response to that just shows that it was wow, I feel good that we're getting, ahead of the game here.
Right.
And, so
definitely. Okay. So here's what I want to talk about with you. And this is kind of the meat of the podcast here.
Okay.
I really want to get into what you think about dental school so far. And I kind of want to break it down into the DBCS, or for those who don't know, the hard science lecture anatomy side of things. And then the other side is kind of the clinical sim clinic drilling wax up kind of thing. So let's talk about the lecture side of things and the hard sciences. Coming from undergrad, because you were a science major, right?
Yeah.
Okay. In bio?
Yeah, general bio. Yep.
Okay. So coming from undergrad to now, was that a easy transition as far as the amount of material that dental school is giving compared to undergrad, or how was that transition, and what is that like for you?
Yeah. So yeah, I mean, I've talked to D1s, D2s before going into dental school, and they all say, it's brutal, that's, so you kind of come in with that expectation.
Right.
And I mean, they're right. I mean, you go in and there's a lot of material they're throwing at you really fast. There's a lot of material you have to learn at home by yourself. They aren't just going to present it all to you. So you have to do a lot of your own legwork. So you have to learn how to find the best resources. You got to figure out how to just pin down what actually matters in the lectures and the material they really want you to know, and not just all the little details. So that was a big difference going from undergrad to dental school, is just figuring out my study style. Since dental school, I've been through, probably like 5 different ways of trying to study. I'm just keep trying, trial and error.
Well, yes. And let me jump in right there really quick, because I think that's really important. Is if something's not working, or even if it is working and you want to try to improve your academic efficiency, trying those so many different study methods can be so helpful, because as you occur different like topics or concepts, you might need a different study technique to most efficiently learn that topic. Right. So what kind of techniques, what's your study routine look like, or what are some different methods that you've tried?
So I first kind of started off with like what I did in undergrad, and that was just I'm not really sure what I did in undergrad. I kind of was all over the place.
Read the PowerPoints.
You could do that. Yeah, you could do that undergrad. You could get away with it, but dental school you can't. And I figured that out in the first exam. It's like, oh man, I can't just do what I normally do. Study the week before or a few days before and expect to do fine.
Right.
You need to be constantly studying. You need to be methodical. You need to schedule yourself, and that's a whole nother topic about scheduling yourself. And even when it comes to like a daily routine, that's something I know you're big on, and it's something that I'm working on, because when I wake up at a good time at 6 o'clock in the morning and I start my day off right, my whole day is so much better. I have a to-do list and I hit certain things. I make sure I get them done. I check them off my list, and that's a huge help.
Yeah.
But going back to some of the things I tried, like flashcards, I tried to do a bunch of flashcards and go through them. That personally didn't work for me. I know it works for some other people, but not for me. I need things to be linear. I need things to be written out in a certain way. So I write large study guides that I can kind of follow through from idea to idea, and that's what helps me. So I handwrite things. I sometimes type, but handwriting's a good way for me to help learn, draw things, make diagrams. I do everything on my iPad. So that's something that UIC requires us to have, is an iPad Pro. And so I guess that's kind of my strategy right now, is currently this is my strategy. It's just methodically doing something every single day, taking notes on lectures that I've, had that day, and then writing them out and just trying to get the main points and putting them into a nice list and something that I can follow through. I guess that's kind of where I'm at right now. So maybe I can update you in a week or two after my next exam and see how it goes. But my grades have been going up, so
that's all that matters.
Something's working. So something's working.
Yeah. And if you find something that's working, you stick with it. But another thing too that is so important that you also brought up, and that I'm big on, is a daily routine.
Yeah.
And this is something we talk about all the time, especially we try to keep each other accountable for waking up early in the morning.
Which we haven't been doing, but
we'll get back on
that.
We will. But one thing, and especially, I've been reading this book, and I'll hand this off to you, but this is the Titans of Dentistry, which, if you guys haven't read this book, it's an awesome book, and it's super easy to read. It's in like a interview style format. So it's not like long long blocks of text. It's quick.
Actually, if I can interject real quick.
Yeah.
Dr. Maloney has, he just posted, he's a relentless dentist he has his own podcast.
Yeah.
So if any of you are interested in that book, he just did a really good summary of it on his podcast. So I would go check that out and then get the book, because he really breaks it down really nicely, and there's so much good material in there. But continue. Go for it. So I haven't read it yet, but I know you are. So
and I'll have to go check out his podcast too.
Seriously, it's really good.
But one thing that I don't even know how many dentists he interviewed. There's a ton of huge names in dentistry in here, but one like common trend among all of them is that all of them are up at or before 5 a.m. And that's the morning is something that a lot of people, especially dental students, I know were studying hard and it's a little harder to get up that early. But if you can take advantage of your morning and get up, there's so many more things that you can do in a day and just be more productive. And if you can stick to that routine, and it really doesn't matter if you wake up early, as long as it's a consistent routine that you follow through with every single day, that's just half the battle of dental school right there. It's just being able to stay on top of your studying, organize things in such a way that makes it easier to study.
Mm-hmm. Yeah, no, I totally agree. Yeah, I think, and I mean, waking up before 5 a.m., I mean, right now I'm waking up at 6 and
But that's early. That's still, yeah.
Right.
And
I'm trying to work my way though to like 5:30. So, I mean, if you've never gotten up early before, I think it's just good to maybe even wake up at 6:30 or 7, just wake up 30 minutes earlier than you used to, and then just keep trying to add more time on as you get, comfortable with that routine. And I think it's going to be, you'll see a big difference, even with your efficiency throughout the day. And
100%.
Even to get back to like how I was in undergrad, I realized how inefficient I was. I wasted time when I studied. I just wasn't an efficient studier. And now, I mean, I'm not where I want to be yet, but I'm getting there. I'm working on it. So work in progress. But so that's something I think you'll learn once you get into dental school.
Absolutely.
Just how much time you actually waste throughout the day.
Definitely. Anything else to add about lectures or anatomy? Like what has your experience been with anatomy? Because that's kind of always the topic among D1 students.
Yeah. Anatomy. Yeah, that's a whole nother animal. It was kind of another experience where it's just kind of trial and error with how I studied. At first, I would just go into lab when it was kind of required and do a lot of studying from home. And I mean, I still got decent grades, but once I started actually going into lab more, taking time out of my day to do that, and not the required time, and just on my own time with a buddy, going in there and actually spending some time with somebody and bouncing things off one another, trying to identify different structures. That's when my grades started rising. So, I mean, I guess that's the biggest thing I can tell all the pre-dental students or D1 students out there is just that, I mean, I think like the first year or at least the first semester, there's going to be a lot of trial and error. Just try new things and see what happens. I mean, there's going to be a lot of that. So don't get disappointed I know we're all trying to be high achievers. We're all used to getting A's in undergrad, but I mean, just don't get down on yourself. I mean, it's going to happen. You're going to have some, failures along the way. And I've had my fair share already in the first, first semester. So just definitely roll with the punches a little bit and learn.
Absolutely. And at the end of the day, everybody in our class is still going to be a dentist. That's the thing.
Yeah.
Right. And everybody has their strengths and everybody has their weaknesses that everybody's trying to work on. So that's just one thing that you have to keep in mind. Really good. And anatomy is super cool too. Although it's tough, it's super cool to be actually the one doing the dissections. Because in undergrad, we had anatomy, but we never actually did the dissections. I don't know if that was similar for you too, but it's really cool to have a scalpel in your hand and actually uncover these structures. It's just fun. Okay, so let's talk a little bit about the other side of things, so the clinical side of our curriculum. What do you want to talk about first? You want to talk about wax ups, drilling? Where do you want to go?
I guess we start with wax ups. Wax ups are, I mean, they're a whole nother skill you're going to have to learn. It's, I guess, another thing. I think the theme of all this is just another thing you have to do when you do wax ups is be methodical with them. Just do them the same way you do them every time. Don't do something different. I mean, like if you have a system that you like, don't deviate from it. Right. I think like sometimes I'll find myself focusing on maybe I just find myself just trying to work on the whole wax up at once rather than focusing maybe on the occlusion.
Right.
at first, not first, but I mean, towards the end, just focusing on that. I'll see something. Oh, I want to fix that real quick. So I go over there and start working on that, and I forget what I was doing, just try to, tackle each section one at a time. I know you have some videos on dental occlusion, wax ups, and check those out, because he always does amazing on his wax ups. His are always like 10 times better than mine. So check his videos out for that. But yeah,
thank you for that. That's
no.
But it's kind of funny too, because what you just said that you don't like to do is what I like to do.
Oh, really?
That's literally how I wax. I know you're a very methodical person, which is great, because sometimes I get lost. But like when I'm waxing up, I'll be like, oh, I need to fix this, and I'll go fix this, and I'll just kind of look at, oh, okay, this embrasure needs to be bigger, or this contact needs to be better. And I just kind of am all over the place all the time, which is why
Well, I mean, you're always going to be kind of like that. I mean, I find myself doing that too. Even when I'm trying to be methodical, I mean, there's something, just like some flash sticking out there. You got to get it. You just have to.
Right.
So you find yourself over there working on it. But I think, so we've done some just wax ups, full crown wax ups. We've done, we did the smush technique, and we also did the additive. What is that called? Additive technique?
Yeah, additive, or with that PKT wax, which is something I'm going to be doing a video on hopefully this weekend. But there's some pretty big differences between them, and
there's big differences.
That's for another day. But do you have any suggestions for wax ups for anybody that may be struggling with them?
I guess find a few tools that you like first. I guess find a few instruments that you like. Don't try to use all the instruments in cassette. They give you like 6 different instruments. Just focus on, what's that one carver called?
Ward's carver, baby.
Ward's carver. Yeah. That's like your go-to.
Yeah.
Just use that, and just use your PKTs, 1 and 2. And
I totally agree. When you're first starting with wax ups, pick a tool that you feel like you have good command of, and you can make that instrument do what you want it to do, and just stick with that. Learn how to carve, learn how to get the proper hand rests, and really learn how to just contour the tooth the way that you want it. And along the way, you're going to find that certain instruments might work better for different situations, but primarily you're going to have that go-to instrument that you're going to want to gravitate towards. So find that instrument, and just run with it, especially in the beginning.
I also found like drawing teeth is a big help too. Is like, because you have to imagine the tooth in your mind.
Right.
So like on your off time when you're studying, it's good to, even for dental anatomy, to study for those sort of exams, is to draw things out, draw the tooth out, but just sketch it. And it's just a big help when you actually go in and add wax, is to have the idea in your mind, because you've drawn it, you know what it looks like. That way when you wax, you kind of can think about it when you're doing the wax ups. I don't know. I think that's another helpful thing that I've done.
Absolutely. Okay. Wax ups, check. Let's talk about some preps and restorations.
Yeah.
How has that been going for you? It's really cool in our first year of dental school that we're holding hand pieces now, which I think is just, and now we have our loops. We got those pretty early on, but now that we have the loops plus the hand piece, I'm starting to feel like a real dentist.
Right.
Which is, it's so fun, but it's definitely a learning process with the hand piece.
Yeah. First off, you need loops. Loops go a long way. I can't imagine trying to do a prep with that one. But I think just don't go in with expectation when you first do your first prep that you're going to be amazing,
Right.
Because it's, once your first time do your initial cut, you're going to be amazed how quick the bit is just going to cut through, and you're going to end up, going way too deep. You're going to, it's just going to look crazy at first. But I think when it comes to drilling, is just spend time outside of class. Go in whenever you can. There's going to be those moments when lecture gets done early, or you get out of some sort of class early, and you have an extra hour lying around, you know what? Go drill for a little bit. Just spend some extra quality time trying to get used to the instruments, trying to get used to different burrs that you get, and try to figure out what personally works best for you. There's a lot of different opinions out there on which burrs you should use, and it's great to get advice on those things and try them out, and then figure out what personally works best and stick with it.
Absolutely. Yeah. I don't think you could have said that any better. You have to put time in outside of class. You can't expect to show up once a week or every other week, whenever, however often you have your sim clinic, and expect to get better quickly. You got to spend time on I like to go in sometimes after class, or when we have an extra hour, like you said, or early mornings on the weekends, just because there's no faculty there looking over your shoulder. There's no other students there. It's just so nice. It's a stress-free environment for you to just really try things out and feel comfortable, which I think is a really big plus of going in outside of like normal school hours. Another big thing I want to bring up too is, and I've kind of noticed this with our class, some people will just rush through things just to get it done and move on to the next thing. And they don't take advantage of that time that they have in the clinic with either, when we're doing perio, we have our partners in the chair, or with their mannequin, and you have faculty there to assist you and to help you. And that's really such a big opportunity to learn and to get their input. And some people try to rush through it and, get in and get out of class. And I think this is something we're all guilty of. We lose our attention span. We're like, okay, I need to get out of here. But just realize that and remember that when you're in class, like that is such an important time, especially when you're in the sim clinic, because that's very valuable time, I would say.
Mm-hmm. Yeah, I would definitely echo that. Like you said, we're all guilty of it.
Definitely.
We know we can get out extra early. We're like an hour early. We're like, oh yeah, let's get this done. Let's go.
Right.
But you need to take a step back, and you have to think someday you're going to be working on actual patients, and when your first patient, you're going to want to have as much experience as you possibly can. Mm-hmm. And along with that too is you have all those instructors there, and they're going to stay there for the full time usually.
Right.
And also just think about how much you're paying.
Get your money's worth.
Get your money's worth. Exactly. You're right. I mean, you can't put a price on that.
Yeah, definitely. So really in especially at UIC, like I love our faculty. Everybody is so willing to sit down and explain things and help us out. And I really challenge everybody who's listening to really take full advantage of your faculty. Ask them something that you're not understanding, or go see them in their office and bring your articulator and say, hey, can you check out my wax up? You're going to gain valuable knowledge from seeing them outside of those normal hours, as well as seeing them, one-on-one in the clinic and asking them questions and things like that. It really is. Mm-hmm. So overall, it sounds like, dental school, it's a struggle, but it's a good struggle.
It is.
We're all, it's tough. The curriculum is tough, with the clinical side, with wax ups and using the hand pieces. Everybody's on a level playing field. Nobody has done that, really worked on that skill before, right? So it's just, everybody's striving to be the best clinician they can be. And yes, there are highs and there are definitely lows, but we're about to enter a really awesome career. So we just have to keep that in mind. So I think we'll start wrapping up the podcast here, buddy. But before I let you go, do you have, and you've offered a ton of advice for pre-dental and dental students, I think, and you've done a really wonderful job. But do you have anything else, that's just one big point before we end this episode?
For pre-dental or dental students?
Whatever you want, or you could do both.
Okay. I guess for dental students, I'm a D1. I've had one semester, so I don't know that much. But I guess one thing, I think we even talked today, me and you, we got an extra 4 hours. And I asked you, I was like, hey, do you want to go assist for a little bit? And we didn't end up doing it. But it was an idea that came to me. I was like, you know what? We got this extra time. Let's go make the most of it. And just, I guess for dental students, just come up with some ideas. Go do something go above and beyond, try something different. Like I said, get your money's worth and try to get as much experience as possible. And I guess that's one of the advices I would have for dental students is just try to find those things.
Absolutely.
And then for pre-dental students, my biggest advice would be DAT. Don't spend so much time on it. Just be methodical, have a certain schedule that you're going to do and keep to it and just crank it out. Don't keep putting it off. I remember when I took my DAT, I actually canceled my first appointment and pushed off for another month because I was like
really
so frantic and so nervous about it. And because I just didn't have a good structure.
Right.
And that's one thing. And another thing is spend a lot of time with your personal statement. Spend some good quality time with that. Don't just rush through making that and have a lot of people look at it. Get some good advice on it. I think that's one of the reasons why I was able to get into UIC was just because I really ironed out, made sure my personal statement was good. And even when it comes to that is when you think of which school you want to get into, if you have that dream school, go on their website, check out what that school is about. Okay. And then make your personal statement geared towards what they want. I mean, don't lie, obviously,
right,
about yourself, but I mean, kind of do what they want, kind of make yourself the best candidate you possibly can be.
Yes. And tailor that personal statement to show them how you would be a great fit for that school based on what they're looking for. Yeah.
Mm-hmm. Yeah.
Well, I think that's awesome advice. And thank you so much for being on the show, Seth. This has been great.
Yeah.
Thank you for finally being
podcast,
on.
So.
Yeah, absolutely. Yeah. You did a great job. And we will definitely have you on again sometime soon. Maybe we'll bring on some other classmates. We'll do a nice collaborative podcast. But for now, I think that's we're going to wrap it up here.
All right. Sounds great. Thanks for having me.
Hey, absolutely, Seth. Take care, buddy.